Hello, I'm Jawad. I'm the Executive Medical Director at the East Lancashire NHS Hospital Trust. This is my COVID update on the 4th of March 2021. I'll start with the total number of COVID patients which are in our hospital, and currently there are 57. Reassuringly, this number is reducing. As some of you would recall that a couple of weeks ago on my update, the numbers were much high. And this is also reflecting in the reduced number of community diagnosed patients. I'll run through some numbers. So in Blackburn with Darwin, we have 137 per 100,000 people who are diagnosed with COVID. 2 weeks ago, this number was 197, so you can clearly see a reduction. Burnley is 107, and again 2 weeks ago it was 131. In Heinberg, it is 152, Pendle 83, Ribble Valley 78, and in Rossendale 115. All these boroughs have had a significant reduction, and it is very reassuring, and it's credit to our public and population who are abiding by what we are supposed to. So I'll encourage people to continue following the hand, face and space element of how we reduce the transmission of this virus in the community. Reflecting is also reduction in the number of our critical care patients. As of today, we have a total of 15 patients who are positive with COVID in intensive care. An equal number are non-COVID patients. What that means is that we are receiving patients with other medical problems who may require intensive care, but it also means that we are now operating on our cancer and high-risk patients who have a planned admission into the critical care unit. But still, the pressures on the critical care unit is still high, and it is a great credit to all our staff who are working in these exceptionally difficult circumstances. Unfortunately, the number of deaths are still happening with COVID, but far reduced to what we had seen in early January and February. Now, we are restoring more and more of our elective services, and you will see requests to attend clinics, whether it's virtual or face-to-face, and I'll encourage our population to attend to these clinics when an appointment comes through. We do provide a safe environment in the hospital, and that has reflected in us being seen on the national tables of nosocomial spread, that our spread is very low. What that means is that the transmission of the virus from a health care associated environment to the patient or population is very low as compared to what we have seen in other parts of the country. And that again is credit to our teams who have put exceptionally hard effort in ensuring that viral transmission is reduced. Vaccination, this is working very well, both within the hospital and the two community hubs. And as you know, it's Blackburn Cathedral and in Burnley that we have stood up these hubs, and these are vaccinating the cohort of people which have been assigned by NHS England and Public Health England. Reassuringly, the second dose of the vaccine have been commenced in hospital hubs, and that will hopefully again help strengthen the reduction of not only the possibility of people suffering from moderate or severe disease should they catch COVID, but also reduction in the transmission. You may all have heard that there is encouraging data coming through trials which is showing that the vaccine is also useful in reducing the transmission of the virus. And again, I'm sure you are aware that more vaccines are being approved by the government and the Medicine Regulation Authority to be then commenced with mass vaccination. Our virtual COVID ward and long COVID clinic again are working well. Virtual COVID ward is where people who do not require hospital admission are managed in their home and in communities by an input from our primary care colleagues, hospital and community colleagues. It's working very well. Long COVID clinics are also being set up and again will deal with any long-term complications or effect that COVID may have had on the population. I think it's important to mention that medicine where it stands now is due to research and innovation. We won't have all the novel treatments and interventions that we now see. Hence, participation in research trials is very important. These trials are robust, have been ethically approved, and are overseen by national bodies. So, if our patients and population is approached by the relevant teams, please join a trial, as it will help us in coming up with novel way of treatment for COVID, because there are still a lot of unknown about this disease, and I would encourage patients and families, if they are contacted by research team, to consent to their participation. The government has laid down a roadmap for easing of the lockdown. That again is very encouraging, but we just have to be mindful that we take it very cautiously and do not undo all the good work that has been done so far. In regards to the visiting to the hospital, we are still adhering to the NHS guidance, in which it is to do with the beginning of life, end of life, a child who's being admitted, or a patient who has learning difficulties. These are the 4 categories that we allow the visitation. Other than that, visiting to hospital is not allowed, and that is to protect our patient, our staff, and our population. Finally, I would just like to mention that in the coming few days we have a International Women's Day. ELHT will play its part in it. We will be all taking a pledge in how we can eliminate the discrimination that still happens in the 21st century with women, whether it is eliminating the gender pay gap or providing equal opportunities, or for that matter, practicing the basic human rights which we all are entitled to. On that note, I'll finish my update today. Please stay safe, look after yourself, and protect your communities. Bye for now.